Welcome to the media briefing today. The doctors we have today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Lau Ka-hin, Chief Manager of the HA. Dr. Au will give us an update. Good afternoon, members of the public and media friends. I now report to you the number of COVID-19 cases reported yesterday on the 19th of May by the CHP. Yesterday, we have received 101 reports confirmed through PCR tests, including 15 reported by the HA, 18 by the Public Services Laboratory, and the remaining 68 were reported by private laboratories. And also yesterday, there were 142 RAT positive results. Altogether, yesterday in Hong Kong, there were 243 positive cases. So far in the fifth wave, we have recorded 1,193,000 cases, including 748 and 1,394 PCR positive and 448,906 RAT positives. Yesterday, there were 26 imported cases, and the remaining 217 were locally infected. Among the imported cases, 17 were caught at the temporary specimen collection center at the airport, and also 8 were caught during hotel quarantine, including 1 on the 3rd day, 3 on the 4th day, 3 on the 5th, and 1 on the 7th. The arrivals were from Canada. There were 6, and 4 from Taiwan, 4 from Singapore, 4 from the United States, 2 from India, 1 from France, 1 from the UAE, 1 from Spain, and 1 from Australia. And also yesterday, there was 1 case which was found positive on the 12th day sample at the community center. That is a positive case involving a 46-year-old male received 2 jabs with no symptoms. On the 7th of May, he came to Hong Kong from India. During hotel quarantine, the tests were negative until the 13th of May. On the 17th, that is the 12th day, as the community testing sample, the sample was unconfirmed, and upon retesting, it was found to be positive with high CT value. That was 33, with very low viral load. We suspect the case to be a positive one. In terms of genome sequencing, Public Services Laboratory has performed 70 tests. All samples are tested negative on L452R strain. For whole genome sequencing, we found an additional 11 BA.2.12.1 subvariants. The 11 cases involved 6 males and 5 females, aged between 19 and 65. 8 cases were from the US, 1 from Turkey, 1 from Holland, and 1 from Nepal. 6 cases were found to be positive at the airport. 3 were tested positive on the 5th day's PCR test at quarantine hotel. 2 cases involved a couple, that is at the 12th day sample as community testing center. So far, we have recorded 46 BA.2.12.1 positive cases. About the 2 cases, the couple tested positive on the 12th day. On the 16th, we have also mentioned them. On the 3rd of May, they came to Hong Kong from San Francisco via CX851. Now, they were quarantined in the Lan Kwai Fong Hotel, room number 3204. During hotel quarantine, all the samples returned negative. Upon completion of hotel quarantine, they went home at Shao Ki Wen. On the 12th day, that is the 14th of May, in accordance with the CTN notice, they went to submit a sample at the community testing center and were found to be positive. 1 of the couple is a 64-year-old female with 3 jabs. On the 12th, that is the 10th day after return, She had symptoms including coughing, headache, and fever with CT value of 15. So after testing positive, she was sent to the Penny's Bay Isolation Center. There were other people who traveled with her. That is a 65-year-old male with 3 jabs with no symptoms. On the 14th of May, also the 12th day after return, he was tested positive with a high CT value, 32, and low viral load. They had no positive records before. The virus strain is a BA.2.12.1. It may be a more infectious. So between the 10th of May and 15th of May, they went to some restaurants and had some activities. So the 11 places they have been to were issued with CDNs. People who have been to these restaurants during the mentioned period have to undergo a PCR test tomorrow and day after tomorrow. Upon investigation, we found that during hotel quarantine, and there were 2 other cases in the same hotel. They knew each other, and they were father and son. On the 7th of May, they came to Hong Kong from Nepal. One of the patients was found positive on the 4th day PCR test, that is at the 10th, RAT. He was sent to an isolation center. The son who traveled with him was tested positive on PCR test on the 5th day. So for the samples, that is, which are 3 PCR samples, were sent to the laboratory for a whole genome sequencing. The gene sequences are completely identical, so we suspect a transmission in the hotel. We've invited Professor Yuen Kwok Yung, a microbiologist from the Hong Kong U, to carry out an inspection in the hotel later today. For care homes, there were no reports from care homes yesterday. For schools, this morning there were 18 reports, all RAT positive, with 17 schools. The 18 cases include 13 students and 5 teaching staff. 4 samples were taken yesterday, and 14 were taken today. The 17 schools are 5 KG, a kindergarten and a childcare center with 4 students and 5 staff, 5 primary schools with 4 students and 2 teaching staff, with 1 primary school reporting 2 cases. That is 1 student and 1 teaching staff. They are not related. We believe that they were infected in the community individually. And 7 secondary schools with 5 students and 2 teaching staff. There are no clusters, and we have seen no outbreak in schools. For death cases, there were 4 additional deaths yesterday. So far in the 5th wave, we have recorded 9,157 deaths. From previous clusters, there are some updates. Yesterday, the Shangwan, Tam Jai, Sam Go, Mi Xian, and Benchmark. There are no new cases from Tam Jai, altogether 5. We collected 16 environmental samples from Tam Jai yesterday, all negative. We have also collected the data of 25 patrons and 15 staff. CDN has been issued. We are waiting for the test results. In terms of a benchmark, among the 5 patrons at Tam Jai, 5 students at the school benchmark. So we have got a list of students and teaching staff at benchmark. and 2 teaching staff and 10 students have found to be positive.
Yesterday, we reported that other than the 4 who have visited Tam Jai, there's also 1 student who tested positive. And together with today's cases, from benchmark altogether, there are 17 cases, including 15 students and 2 staff members. So their onset started from May 13th to May 20th, and most of them were tested positive on between May 16th to May 19th. We collected around 20 environmental samples this morning, and we are still analyzing the data. So in Kwun Tong, there are 2 people who still haven't gone for the compulsory testing, and they have now done it. 1 is tested negative, 1 positive. So altogether in Imperial Restaurant, there are 30 cases. So that is all I have to report for today. Dr. Lau, thank you. Good afternoon. As of today, there are 553 patients in the public hospitals, North Lantau Hospital, Hong Kong Infection Control Center, and the Infectious Disease Center, 51 new infected cases. So out of those who need to be admitted to hospital, 91 of them are in isolated wards and 23 in other isolated wards, and then 43 are in North Lantau Infectious Center, and there are 15 newly confirmed cases. Yesterday, 1 person is critical and 1 in serious condition, and there are 10 who are now in critical and serious condition. Out of 3 are in the ICU wards. There are also 4 other patients who in the past 24 years passed away, 1 male and 3 female with ages between 64 to 95. And out of the deaths, 3 are above 65 years old. None of them come from elderly homes. 3 patients do not have any vaccine records, and 1 has been triple jabbed. 91 patients have recovered, including 69 who have been discharged. In the 5th wave, there are 49,675 patients recovered, including